So hopefully you can hear us all well and it's all fine. Thank you and apologies. Thanks for waiting. So welcome to the Haringey Health and Wellbeing Board. Just need to remind you all of the filming at meetings. Are we now recording? Yes. Yeah, thank you. Please note this meeting will be filmed or recorded by the Council for live and subsequent broadcast via the Council's internet site by anyone attending and participating in the meeting. Anyone attending and participating in the meeting should be aware that they're likely to be filmed, recorded and reported on. By entering the meeting room, you're consenting to being filmed and to the possible use of those images and sound recordings. The chair of the meeting has the discretion to terminate the meeting or suspend filming or recording if, in her opinion, continuation of the filming, recording and reporting would disrupt or prejudice proceedings, infringe the rights of any individual and may lead to the breach of legal obligation by the council. So thank you very much, everyone. Welcome. And most everyone knows me, but reminder, I'm Lucy Neves. I'm the Cabinet Member for Health, Social Care and Wellbeing. And I won't do full introductions, but I'll just highlight that I have to my left, Councillor Brabazon. Hi, everybody. And who's the Cabinet Member for Children, Young People and Families. And we also have the Chair of Health Watch in the room here. And if you could please, when you do speak, just introduce yourselves. And that way, the members of the public or anyone else in future will be able to hear you. So thanks very much. Do we have any apologies for absence?
Apologies for receiving Councillor Mike.
Thank you, Naz. We have any urgent business?
No.
Any declarations of interest? Anybody?
Got one as it when stop.
Okay, fine. Any questions, deputations or petitions received in advance? Thank you. And so we move straight to the minutes of the last meeting on the 28th of June 2023. Does anyone have any feedback on the accuracy of the minutes? Any questions?
Chair.
Sorry, would you just introduce yourself?
Sorry. Your name's John Porter, Haringey tenant and 2024 Paralympian, qualified for Paris. Thank you. The thing I'd like to highlight and bring up, I have wasted a lot of time with previous people that were in attendance at previous meeting, ABC parents. They were at the meeting, they attended the meeting. I devoted a lot of time and effort along with other participants to Big Britain, and they failed to attend meetings, failed to respond in any communication. And then when I went down to where their offices were, they'd been vacated. I just want it highlighted to avoid any carnage with anyone else before these individuals attend meetings. Can they be thoroughly vetted, please?
Okay, well, I'm sorry to hear that you had difficulties interacting with the organisation, John. I would suggest it's probably appropriate for us to pick that out outside this meeting together, if that's okay. And just to emphasise, I'm always available on email at any point, so probably is a better thing to do rather than in the meeting itself. But thank you, if that's all right. Are we happy that the meeting minutes were correct records for the last meeting? Okay, thank you. I'll take the minutes as accepted. Thank you. So we're now on to item 8, which is an item on the Wood Green Integrated Hub and Community Diagnostic Centre update. And Jonathan, is that you?
Yes, that's me. I'm Jonathan Gardner. I'm Director of Strategy at Whittington Health, and I've got online with me Sophie Harrison, who's the Project Director for the Integrated Health Hub, and also Mustafa, who is the Service Manager for I don't see him actually online. He was there a second ago. He's the service manager for the other thing that we want to update you on, which is the Community Diagnostic Centre. So just two things we wanted to cover off, and I'll hand over, it's all right, to Sophie to present the first bit on the Integrated Health Hub, if that's all right.
It's absolutely fine. I'm not entirely clear, not being in the room, as to what site people have got of the presentation that was circulated in advance. Jonathan, is that something I need to bring up on the screen, or is it available?
I think that would probably be helpful. It's in the papers, but why don't you put it up on the screen?
Yes, please.
Okay, can people see that?
Yes.
Okay, so I'm going to take you through the first few slides on the integrated hub, and then I think I'm going to hand back to Jonathan with support of Mustafa on the Community Diagnostic Centre. So bringing you really an update on the proposed Wood Green integrated hub. This is a very much a partnership working across a number of organisations and also the NCLICB, to look at how we bring a number of services together from different organisations into a very central location. And not only do we relocate services, but actually we work differently when we move to that location. So we work in a way that is integrated as opposed to co-located. What this slide shows you is some initial thoughts about some of the ideas we've had about how the look and feel of the hub, but also some sense of the types of services that will be likely to be relocating and integrating within that hub. So as you can see, range from mental health services through to the council support and advice services. A primary care practice would move, the Hornsey Wood Green practice will move in there, and then a whole range of other community-based services that currently are in other locations in Haringey. So that's just a quick starter for feel. Those who are not familiar, the intention is to put these services into a location within the Wood Green shopping mall. That will be very, very close to the Community Diagnostic Centre. So one of the other parts of this is to say, how can we work much more closely between those services and the diagnostic services to improve the offer that we give, that we provide for residents of Haringey. The second slide is very much a summary of why we're doing this, what some of those issues are. That first quote is very much a quote from our lead GP from the Hornsey practice, and I'm not going to go through it in detail. Hopefully you've seen it, but really it's about trying to reinforce that this isn't just about relocating services and providing better facilities. It is very much about that, but it is also more fundamental to that in terms of how do we use this as an opportunity to deliver services differently in a more integrated and resident focused way. The third slide just reminds us that this project has been in gestation for many years now, but it is also about making sure that it addresses some of those objectives that have been agreed within Haringey over the years around addressing quality and accessibility, addressing those wider determinants of health, looking at how we're proactive around health rather than reactive, and that piece around collaborative behaviours and coming together. And you'll see an indication of the organisations there. Just a very brief reminder that a couple of consultations, formal consultations, have already taken place around the hub, both in terms of relocation of community-based services, and that was a formal consultation that was considered by the OSC and supported, and also a consultation around that relocation of the primary care practice, which was also supported. So those consultations and initial consultations have taken place. Last summer, we did a series of workshops with residents and services to understand some of those things that people wanted to see this hub delivering on. And again, quite a lot of detail here, but there is something about what we heard in terms of how to access services, the types of spaces people wanted to receive services in, and some of that those key issues around feeling safe, things being accessible, how to be right place first time rather than move between a range of different services. These were translated into some design principles, and these are informing the design of the facilities and also the very key piece of work that is going alongside that design of facilities, which is how do we really consider that service model across all of those different services and deliver it in a more integrated, more efficient, more responsive way. We've also been doing lots of conversations across a whole range of different organisations in Haringey, and these are some of the messages that are coming out. Again, repeating some of what we've already said, but you know, that thing about disability access and making sure it's about the broader range of disability access. Something about digital exclusion. There's a bit of initiative that says everything should be digital because that's the way we should be going, but recognising that we need to make sure that we're addressing people who find digital hard or find access to digital difficult. So how do we meet some of those needs? The importance of engaging with residents, patients and staff in developing that service model and making sure that they're at the forefront of those changes. keeping that resident experience there. How do we make sure we learn from some of those other projects that are happening? Northumberland Park, the Community Diagnostic Centre, there's lots of learning coming out of those projects that we can use within this hub. Connecting with public health, the importance of health promotion. How do we use these facilities to promote, not just respond? How do we address health inequalities? You'll hear some really good work that's being done in the Community Diagnostic Centre to really measure how some of these community-based services can really start addressing health inequalities and access. And how do we make sure this is seamless and integrated in terms of the service that residents receive? These, again, detail, but just to give you a sense of some of the scale of what we're trying to achieve here, for those that are interested, it's about 3,000 square metres of space across 2 floors. It is the New Look space within the Wood Green shopping mall that New Look recently vacated. It's even bigger than the New Look because there's lots of New Look space that sits behind walls. And it looks at a very general space on the ground floor, which is mainly focused on primary care, meeting room space for a range of activities and those long-term condition type activities, and phlebotomy and advice rooms. Upstairs, more specialist spaces, MSK, physiotherapy type services, community dental services for those who find it really hard to access the kind of the normal high street dental, and it's a whole range of audiology services from very young children through to frail elderly. So that's the proposal. This is the early stages of design around those layouts. We're currently working hard to unpick every single room on these 2 plans to make sure we understand how those rooms need to function, the types of equipment, how to make sure that they're accessible, etc. We're also looking at how we can create spaces for private conversations, how we can make sure that office space is used really flexibly and efficiently, how we have space for advice rooms, both within rooms, but also some of these pod type spaces within some of these open areas for some of those more private conversations, which don't necessarily need to be behind a closed door. So that's the floor layouts. And then just a couple more slides, really just a kind of brief reminder, really, which is where this project is at. The business case for this project was taken through the Whittington Health Trust Board in November 22. The Whittington is the kind of lead organisation for this, but working very closely with the partners. And this project also reports through to the NCL Local Care Infrastructure Board. So it was approved at that point by Whittington, and we received formal letters of support for all the associated partner organisations in early 2023. At that time, we had a budget, a project budget, total budget of about 13.5 million, plus a bit of extra for the primary care services. And this gives you a sense of how that was agreed to be funded. So Whittington Health putting in some capital from its capital pot, but also looking to dispose of 3 properties. Bounds Green and Edwards Drive are in the central north part of Haringey. Stroud Green Clinic sits next to the Osborne Grove development. We envisage all 3 properties being empty, ready for disposal, and we've already had some early conversations with London Borough of Haringey about possible interest in those sites. London Borough of Haringey, we're very grateful, have put forward a £1 million grant for this project, partly in recognition of that core regeneration of Wood Green, and part of those the benefits to come from having this health facility right in the heart of the Wood Green High Street. And then we have an NHSE primary care grant, which links to that primary care facility in the building. We also have letters of support for the revenue funding, and that is something that is obviously associated. We have a capital piece and a revenue piece of this business case. I would just say this was the position last November. We are currently in the process of reviewing all of those costs in light of the more detailed design work that we've now done. You won't be surprised to hear that some of those costs are coming in higher, and we're currently looking at whether we can bring those costs down or whether we can source any other alternative funding sources for some of those costs. We're not being helped by some of the inflationary pressures in the construction industry. Last but not least, this is the timetable as it currently sits. So as I say, we've done the 1 to 200 floor layouts. We are very much in the heart of that really detailed design at the moment. We have the service model pathway and digital design development running in parallel. We have a bit more time for that. There's quite a long lead in before this would open, but we're making sure that we're starting to consider how that can influence any of the facilities. We are planning to go to broader workshops, again, repeating what we did last summer in October and November this year, with that wider resident and service input, working with public voices on that to support us with that piece of work. We will be looking to go out to tender for works, and then obviously developing that hub operating model as we move forward, and then delivering in the future. Again, what I would just a small caveat: this project moves quickly. Since I put this paper together, we are also looking at that timetable to say if the costs are up, do we need to move this project so that it covers a number of financial years, partly due to constraints on capital within one financial year. So we are just looking at this timetable to see whether it needs to shift a little bit, which would impact on that start date. We are very keen to make sure the site is operational in 2025. And I think that's it. Jonathan, did you want to add anything?
Thank you, Sophie. If I may just sort of add a little bit, and then I'll talk about the Community Diagnostic Centre. So I guess we just really wanted to bring that back here to say how far we've come, that the designs are now really well thought through, with a lot of input from engagement throughout the process, and a huge amount of work with Sarah and the other council teams to be continually improving the way that we're working together and doing this jointly, and then also with Rachel and the primary care teams as well, and their engagement. I think, you know, Sophie went quite quickly through the benefits, but I'd just very highlight that, you know, that regeneration benefit is really key. That accessibility benefit, you know, moving these services right to the heart of Wood Green is going to be absolutely transformational to the way that people can access their services. And then that integration benefit, putting council services right next to a GP, right next to community services and mental health, all in the same entrance with the same way of working, is going to really transform the way that we can impact on population health, prevention, and working together. So we're looking for continued support. It is not an easy journey as we get to the final part. Whittington Health is going to have to sign the agreement for lease at the end of October if we're going to get that agreed with Capital and Regional, and that is a big risk that we're going to need to take, and we need your real support to get us over the line, because I think it's going to be really beneficial for Haringey and that reinvestment of property into something that's going to be even better. So that's that. If I go on to the Community Diagnostic Centre more briefly.
It's worth pausing and just
Yeah.
a bit on the health. It's worth pausing and just doing a little bit on the health centre specifically, just because we're a bit lost, and they are two different things, even though they are interconnected. I had a couple of things that I just wanted to ask and bring forward before, and then I know that John's indicated and others may well ask questions. I just wondered about risk and certainty, because we've been a bit, the journey of achieving a health centre in Wood Green's been difficult. And we've had a few twists and turns, certainly in the time that I've been a councillor. I want to also just celebrate this piece of work and thank you, because I think it's so important to so many of our residents who really need this facility, and we've been waiting for some time. So then hence my comment about the twists and turns. And so I wonder if you wanted to say a little bit about that risk, especially given the financial climate. We know the strains and pressures. It'd be useful to just hear from you how you're managing and measuring that risk, and what you think there might be, what the challenges might be, going forward a little bit more detail. I also wondered if you wanted to talk a little bit about the experience that you're using, that you're going to bring in informing how you run a service like this, because it is in a different kind of location to some kinds of other health facilities. Obviously, you've got the experience of the CDC to help you learn from that, but there'll be a new and different kind of mix of quite often very vulnerable patients. That's my concern, that we've got a plan and a way in which you can manage and think through that, and that there are other places that you're learning from around that. And then my other, Sophie mentioned accessibility, but I feel really passionate and about making sure that we really do everything that we can. I know there've been some, I've raised this with you before, but I wanted to raise it with you publicly. We really want to make sure that this is really fitting the bill for residents, really is accessible, especially for all types of wheelchair. I'd be doing my duty as a social moderate disability champion for Disability Action Haringey if I didn't ask that question. It's good to have reassurance on those things. And then I'll bring in John and Zena afterwards, but maybe you want to go with those.
Excellent. I think that question of risk is kind of why I flag it and want to really raise it here, because it is something that I'm a little bit concerned about, because there is the capital risk and we are having to do a lot of persuasion internally in Whittington Health and in the system that the allocation of this capital is the right thing to do, because we are all terribly capital constrained. So I think I can give some assurance that we're behind this 100%. We think this is the right thing to do. I wouldn't be sat here continuing to sell it as a concept and keep it going. And I think Sophie and the team will know that I've been driving this forward right from the start to make it happen. I'm confident we can make it happen. If there is anything you can do as councillors and as a wider to raise the profile of this and help make sure that this is seen as a priority for the council as much as it is for Whittington Health and for our colleagues, that would be helpful, I'm quite sure, in terms of making this happen. As I say, we will have absolute certainty at the end of October when the lease is signed, because we will be signing a lease for 30 years that will commit us to making this happen. So that is why I'm here now, because we are going to be having to make a decision as a system to commit to this. I want to ensure that Haringey are as behind it as you say, as much as Whittington are behind it, because it is a big commitment. And once we sign that lease, we have to make this happen. So hopefully that answers as much as I can on the risk. I agree, we need to celebrate it. I think we have come a long way, and I'm really excited. In terms of how to run a service like this, and the varying patients coming in, I think part of that will come through continued work over the next year. So this part is the design and the build, and I'll come to the design part of it in a second. But the how do we work differently is a longer term process over the next year as we build the teams in the right places, working with Nadine and the teams there, working with your council teams to say, what does this look like actually on the ground? We're talking about things like having, not even a reception, but sort of joint floor walkers who can talk to being a GP client, as it were, as well as a council client, talking about a different approach to that. So I would certainly hope that over the next year we'll be able to come up with, and as Sophie said, one of the key things here is that engagement with clients, service users, patients in that process, and that's an ongoing thing over the next period of time. In terms of accessibility, I might look to Sophie to say some more, but one of the things I would point to as an example of how we've really looked at accessibility is, again, like we did in Tynemouth Road, we're putting a changing places toilet and shower in that's accessible to everybody, and that is a big shift in terms of accessibility, and we're really proud to have prioritised that in the building. But Sophie, I don't know whether you want to add anything more in terms of wheelchair access, and I know that we've been doing a lot of work with disability access companies to make sure it's designed correctly, but do you want to talk to that?
Absolutely. So it's absolutely at the forefront of that design process, and what we have done, in addition to a design team who have experience, have a huge amount of experience in delivering healthcare facilities, but actually to supplement that, we've also brought in Accessible, who are a company that purely focus on disability access in its broadest sense, and what they are an integral part of that design process currently, and are providing a whole range of feedback, both at that level of design that I've shown you, but also at the individual room design, so that we are ensuring that it is accessible in the broadest sense. We are making sure that, and what we're doing is we're tweaking the design to address that. We may not, I'm going to be brutally honest, we may not be able to be 100% perfect, but what we are doing is making sure that we are responding to every single comment that we're getting back, to make sure that we can make sure that these are accessible. What we may be doing, for example, with community dental, is that we're looking at a number of different size rooms, so that if we can't make all the rooms big enough to take the biggest size of wheelchair, we make sure that we've got at least one or two rooms rooms that will take the biggest size wheelchair. So there's some issues like that we're addressing through making sure that we've got a full range of facilities that will be able to meet that range of access needs. So we definitely have some real experts working with us on this, and I'd hope that would provide assurance that we are addressing it. I can take you through some of the detail outside of the meeting if anyone's interested. And as I say, we will also be taking this through some wider workshops. Andrew's on the call, is going to be supporting us with that as well, with Public Voices, to just make sure that we've tested again what we're doing and that it's going to meet resident and service needs. So yes, absolutely, really fundamental to this project.
Thank you. That's very helpful. I just recommend that we make sure that you have an opportunity to share some of those discussions with Disability Action Haringey and with some of our other groups, board, etc., and to just go through some of those compromises that have to be made, because I think that might be helpful to you.
Yeah.
That will also grow the understanding of what you're trying to do. I mean, I have to say, I do have a slight concern, which is that for me, often design and delivery go together. So because we're doing design and then we're working out the service, and I mean, I understand what you're saying, but it just feels really important that those two things interact and can change one another, if that makes sense, in a positive.
Yeah.
Just, I might have described it too much in a sort of a linear fashion. Absolutely, over the last year, you know, as Beverly and Sarah will attest to, we've been working with the council already and with others on how things could work differently. So it's not like we're sort of just doing the design in one place and then doing the workforce afterwards. But I'm describing that we've got further to go.
It's
Thanks very much, Jonathan and Sophie. Really excellent progress. I suppose I just wanted to go back a bit to the issue of risk, and this is a significant capital project, and certainly we know with the current climate, the challenges we've got in the construction sector, the financial challenges organisations are actually facing. And I suppose I just want to note that we probably need to engage in further discussions around the risks and potential mitigations, because I think certainly in the council we've seen significant challenges on other construction projects. You know, organisations just falling away, unable to deliver, etc., significant delays, and the climate is, you know, worsened since the original inception, and I just want to raise the profile of that.
I think that's right, Beverly, and actually I'm sure that you have a risk register and a governance setup that manages that, but you might want to consider how you bring some of that to here, because I think people here around the table will want to kind of know about that and know you have that under control. And I'll leave that to you. I won't say bring your risk register here, but because that might not be appropriate for your governance, but certainly just having sight of some of those issues and making sure we're having all the conversations really closely. Beverly's quite right. It is a very, very, very difficult climate at the moment. I think you're already aware of that. I had John waiting for a question, then Zena, then Jeffrey, and then Sharon.
Yeah, this year, like addressing everyone, thanks for involving me. Right, my industry, the way to minimise risk. You need associations and federations that have comprehensive insurance, whereby you've got guarantees that what the price is, the job will get done. It's easy and simple. Right, I'm with the NIC and that bit because I'm a qualified electrician. My workmanship has to be industry standard. If I go under, they will guarantee the work at any one point to prevent your contingency being dug into. I am giving you what classes federation information, whereby if you get a subcontractor in there that's got no experience, no understanding, he goes under or he disappears, your contingency budget will take.
Actually, I do have a question as well.
Yeah, the other question I've got, which yourself and your colleague described, accessibility, right? It ain't just the actual fabric of the building. They go there with dial-a-ride. Dial-a-ride have got no access anywhere near the fabric of that building. they either drop you off at Wood Green Station by the cinema or the other end, right, by Turnpike Lane. It is a complete red route all the way along now. It is buses only, everything, right? And you're expecting people to turn up there, right? I'm asking you, as a professional, same as your colleague, wherever people are dropped off, you're going to have to arrange some form of secondary means in getting those individuals to the location if they're elderly, frail, disabled, or limited in their capacity to get to the venue, because there's no means in a drop-off area for those to be dropped off at where you're proposing this fabric of the building being done. Thank you. Thank you, Chair. Sorry, that's
No, that's okay. Thanks, John. I just want to comment on that. I understood, and I might have misunderstood, that there was going to be space at the rear of Shopping City. Do you want to say a little bit about that, Jonathan? I don't know if that will suit what John's talking about.
Sophie, do you want to talk to that one?
So what we have at the moment is a commitment from the landlord to enable us to allow non-emergency patient transport drop-off in the service yard at the back of the mall with direct access into the ground floor of the hub. So what I think I need to pick up slightly separately is a dial-a-ride question, because obviously if people can access non-emergency patient transport, we have an arrangement in place that means that that can be brought right up to the front door of the hub, well, the door of the hub. So I think it'd be good if I could pick up separately the question of the dial-a-ride access. We certainly have access via the car park, but obviously if vehicles cannot access the multi-storey car park, then we need to understand what that issue is and how we might be able to address that.
Thank you, Zena.
Yeah, I was going to follow up about disability access as well. I was thinking of someone, if I could be a bit personal, for like my sister who's got mobility problems and lymphedema, goes to Stuart Crescent, which is really difficult. And I would hope that she can drive, but when I was thinking, how would she get down there and all the parking stuff? I think it might be worth talking to Capital and Regional about spaces near, if there are not enough spaces near the lifts, because if you're going to have a big chunk of Wood Green Shopping City given over to a health centre, I think they may want to think about parking spaces, accessibility to the lifts, and how people feel safe in the parking. I mean, dare I say, people who are old, can't run and got crutches and all, I think there are some issues they might want to explore, but that wasn't my main point really. I'm a bit more interested in governance. I think these are very complicated projects. Sorry, I got this all confused with the diagnostic hub. I thought I've been down there, it didn't have all that in it. So forgive me, this has passed me by. So I'm coming to it afresh. But I do have some experience of these joint projects. And certainly I know that in education, where special school, there's one, you might know, in Islington, Golden Lane was the first inclusive sort of campus, one of the first in the country. There were big issues about governance because you had different cultures coming together on a shared site with different values and so on. And I've looked through this and there's just a sort of reference to governance, but I really think it's an important issue. I think it's really important when things can be successful or fail if those partnership arrangements don't work and if the governance isn't clear. And I just say that as not to be cynical, but to be helpful. I think it is a really, really big issue, and I think it's often overlooked in these sorts of projects. People talk about the practicalities. Well, think about what happened to the Laurels. I know the Laurels really well. How that went, we had all the aspirations, the ambition, and it did not run well. You had different providers on the site, different sets of values, different GPs. It was a really big learning curve. So my next question is, have you learnt anything from the Laurels? You've got the wonderful centre, moving on, this is the next point, it's not about governance, but about good practice, the West Green practice, which I thought was really well designed. It's in my ward, really well designed, and has got really good values and the way it's working. So I think there are some good things to learn, but I think we also have to think about, because this is really complicated, got umpteen services, and if I hate to be critical of the National Health Service, it is possible some of them may not be direct NHS providers. They might be contracts. I don't know. I never understand health except it's all, you know, free at point of use, but not quite organised that way. So I think it is an issue to be explored. That's why I want to make that point strongly, because we want this to work. I think it's fantastic to see all this. And my final question is, if services are moving here, what's happening to places like Stuart Crescent and other centres nearby and the reconfigurations? Oh, those are my points. Oh, one more point, Jonathan. It's the same point, Tynemouth Road. In the lovely CAD drawing here, the RT drawing, that seating would do for my sister would go bonkers if she had to go to lymphedema clinic with that seating. She would complain till the cows come. I can assure you. So can we have some proper seating for people who have to use their arms, not the rest of it?
Yeah, please do.
Thank you.
Sorry, I think let Jonathan respond, please. That's okay. And I've got other people waiting, and then I'll come back to you, John.
Thank you for all your comments. Briefly, we have very good contractual arrangements that will mitigate the risks in terms of once the project has started. Also, in terms of the risk in terms of capital increase and that sort of thing, because of the construction industry, we believe we have mitigated that to a considerable degree, because we are now at the point of having the latest quality surveyors, and we're about to start and go to tender. So we don't think it's going to go up further from here, but it has gone up since our last conversations. In terms of governance, it's a really good point. Right now, we have governance around the programme. So we have a steering group that's chaired by myself, Sarah as a member, Rachel as a member, and all the different partners are members. We also report into the Place and Neighbourhoods Committee from the council. So there's some governance there, but I think what you're talking about is the ongoing governance of running it. And I think that's an absolutely really great question that we'll take away and work out how do we make sure that that continues.
Well, I can't tell you. You can fall at the first hurdle.
Yeah, absolutely. No, I think you're absolutely right. Have we learned from the laurels? I'll be honest, I don't know that I have. So let me take that away and we'll make sure that we do, because I think that's a good point.
Let's have a conversation with you, because I worked on the laurels at the beginning when it was a new deal for communities, and what the aspirations were and then what happened.
Okay. Thank you. That'd be helpful. In terms of what's happening to the other centres, so Stuart Crescent isn't changing, but Bounds Green and Edwards Drive, we are looking to close those and we're looking to sell them. So we're also looking, I understand that the council is quite interested in those as development projects. So that would be another area of risk and opportunity and conversation to be having. No, let's here just be really careful. So there's two different buildings, and we got confused earlier on. This is not the Bounds Green practice of GPs. This is the buildings that are next, not far away, that are the Whittington Health Community Services. There is no change to the Bounds Green Health Centre from a GP point of view.
Very keen to emphasise that, because there was some confusion out in the public domain. One might question why that messaging was the way it was, but nevertheless, and it did cause a lot of concern for people. I happen to be a Bounds Green group practice patient, and I'm very reassured that practice remains a local practice. And I visited the two other buildings, which are to the rear either side of it, which are the two buildings that will close. So I just think that's a really important message to note in the minutes, so that people don't feel alarmed that they're losing their really vital, well-loved service. So thank you. Jeffrey, I'm going to bring you in, and I'll bring Rachel in, and then I will bring you, if you've got time, Jonathan, again.
I think Chair Vida is before me.
Vida was before you. I'm sorry, Vida, I didn't see the hand. I'll bring Vida in. Thank you.
Thank you very much. Yep, I'm a carer, and I don't think a lot of carers know about this diagnosis center. That's the first. Secondly, is it going to be a walk-in or you have to be referred to? Thirdly, I want to find out about the dental the clinic. Is it going to be for people with special need as well?
Special needs.
Special.
Shall I just come in before you come in, Jonathan? Just to say, Vida, so at the moment, so we've got the Community Diagnostic Centre. Jonathan's going to come in after and talk to us a little bit about that. This is just the health centre. This is a new service. And maybe Jonathan will pick up the issue of carers not knowing about that. Just being really distinct. They're two distinct things, if that makes sense. Just in case that wasn't clear. Jonathan.
Yes, thank you. I didn't quite get that first question. In terms of walk-in, the services are the existing services that are around the place. So most of those services are referral services. So that might be podiatry services, that might be health visiting services, that might be other types of services, and there will be a GP practice. But the centre will be a walk-in centre. So what we want to do is create this vibe of people being able to walk in and get advice, guidance, support, whether that be council services, whether that be mental health services, or whether that be community services. So there'll be a mixture of being able to walk in, but also some of the key services being by referral. In terms of dental services, yes, our dental services are quite unique in that they are very specifically for those patients, often on the younger end, but also older people with learning disabilities or other disabilities who can't easily access the dental services on the high street. And so these are quite unique services, and we're very proud of them. We run them in 10 different boroughs around London. And so that's what those services are for.
Thank you. The reason why I'm talking about the dentals, my son has been discharged from St. Anne's Hospital for about 5 years. He doesn't want to go to any dental practice. He wants to go to St. Anne's. And I've kept on and on, but no, they don't want to have him back. He's been discharged. So he hasn't been a dental, for 5 years. So I just want to know if this would my GP will be able to refer him to this diagnostic center, or what do I do? I just want to find out.
Can I take that away and find out for you?
Okay.
It is the same service that is happening at St. Anne's and other places. So it is not a new service. So if your son has not been able to access that service, that's a separate question that I will try and take away and understand for you.
Let's try and reframe that and just say that there might be a question about who can or can't access that service, and maybe we should pick that up and have a written response. I think just on that, let's try and pick that up. Vida, it sounds as if it's whatever there is at the moment, but what I'm hearing from you is that perhaps people who'd like to be able to access that service aren't able to. So let's pick that up outside, and Jonathan, we can provide Vida's email address so we can make that connection. But thank you, that's very useful. I'm really conscious of time. Jeffrey, I'm going to bring you in.
Thank you, Chair. Just on the last point about the laurels, I suppose thanks to Councillor Brabazon and others, that's where I'm sitting at the moment, and quite happy also to contribute to the lessons learned from that, if that's helpful. Thank you, Sophie. Thank you, Jonathan. I think happy to see actually progress being made on the health and well-being, the integrated hub. Even happy to celebrate it, I think, as has been mentioned. I think my question is around the VCS, though, as you'd expect. I'm good to see, and well done on the consultation, 300 plus VCS and lots of residents. If we are serious about, or we are talking about wider determinants, prevention, early help, and partnerships, I thought the slides could have done more about what our aspiration there is, working more holistically with the VCS. I don't know whether, Jonathan, that will come as part of the service development that starts next month, it seems. So I just want to know how we're going to be working differently and working with the VCS as well. What's the scope there? So it's a fairly simple, awfully simple question. You think of care navigators, social prescribers, but more than that. Thank you.
I think that's a great question, and I think we are doing some on that, but we need to do more. So let me take that away and make sure that we are doing enough. Because funnily enough, I was only just talking to another system down in Dorset who have created or are beginning to create something similar, and they came up with some really good ideas that I'm going to try and bring into this. So very much keen to work with you and the VCS on that.
Thank you.
Thanks, John. I think it's helpful. It's come up, I think, before already, hasn't it? So I think it's really important that we pick that up. And I do have a slight worry, which is that you answered the question Vida asked about walk-in, and you rightly said, of course, lots of people will have specific appointments they're coming to, but you'll also have walk-in, and I can see great benefits to that, but also a slight concern about how that, and it comes back to my original questions about management, about the message, what it is people can and can't seek. So I just think there's something really important there. Sharon.
Yeah, thank you. I mean, it's good to see such progress on the project. My sort of general point is about the importance having throughout the project programme some very clear means by which patients are going to be consulted at every stage, and in particular on the architecture side, we've done some good work on other projects in the borough in which users have been involved, in the way in which the building is designed and shaped in quite specific ways, and we can do that, but it has to be allowed for in the project plan. It also, as we progress, we're already hearing questions from patients, very specifically patients, what this is going to bring for them. And we need to be hearing what people's expectations are and looking at how they can be met. But I think in particular, going back to the earlier questions about risk, I think in particular, patients need to be involved, or patient groups, volunteer sector groups, on how risk is managed. We, like Zena, I've been involved in a number of capital projects, and the biggest risk is that money runs out and things start to get chopped. And we need to be very clear about what it is that might get chopped, and the likelihood is that something will be, and those decisions need to be made with patients, not just with managers and clinicians, if it's going to fall short of expectations. So I'd like to see in the project plan all the way through the point at which there's going to be touching base with patients and voluntary sector.
Thanks, Sharon. I think those are really key points. Hopefully you found those helpful. I'm going to bring John in, but only really quickly, please, because otherwise
your question and your question both at the same time. In regards to dental, when the refurb was done in St Anne's, refurb was carried out and was transferred to Kentish Town. Software got updated. During the update, all patient history went down. Now you've got to re-refer yourself back to the original carnage. I'm highlighting to you as not only as a patient, but as an individual, that I'm now having to waste an hour and a half in an ambulance, which I'd done on Monday, going to Kentish Town, because the referral system's absolutely not worth the paper it's wrote on. They're telling me I've got to wait 6 to 8 months, right? Even though I'm in Kentish Town. I was at Whittington for 10 years before the refurb. Why is your system complete carnage to those that were there pre-refurb? Thank you, Chair.
I think that's really useful, John. And perhaps we could pick that up again as a written response. Understood. No, you were very clear, John. Thank you. I think that's really useful. Thank you. Always good to have those voices to give us the reality out there. Thank you very much. So would you talk a little bit about the CDC now?
Yes, and Sophie, would you mind just sharing again so that people can see the slides?
Slight challenge. I've got to attend another meeting now.
You don't by any chance have them, do you?
Yes, I can support with that. Yeah.
Thanks, Mr. Thank you. Apologies.
while Mr. was bringing them up, I'll start. So this is now the Community Diagnostic Centre. To be very clear, this is already up and running. So if you go into the Wood Green Shopping City at the moment, you will see that we've taken over a shop frontage and created a community diagnostic centre there. That is currently serving patients from across Haringey and probably a little bit beyond on phlebotomy or blood tests, X-rays, ultrasounds, and ophthalmology eye tests. And it's part of a bigger program. So it is part of 2 community diagnostic centres in North Central London. And overall, we've managed to secure for North Central London £31 million worth of capital to make this happen, and £46 million worth of revenue over the few years that we've been running. We're really proud. We've now hit year 1 of it being open, and we've done 40,000 tests. And these are extra tests that otherwise wouldn't have happened in the NHS, and therefore are reducing waiting lists, as I'll come to in a minute. And we're currently doing about 4,600 tests a month, and we will be doing 8,000 tests a month shortly. This is direct access, so you do have to have a referral. But what's nice is that it is direct access rather than a GP going to a consultant in a hospital to then have a referral to a diagnostic. So a GP can directly refer you into the community diagnostic centre. And we've been working really closely with GPs very close to this area, so that we are really targeting the right patients who are able to easily access, but also might have otherwise had to travel longer distance to other areas to get their diagnosis. So if we move to the next slide, because what I really wanted to show was the impact that this is happening. So the CDCs are doing about 6% of all the total system imaging activity in North Central London already, which is amazing. And we've delivered a lot of that target imaging. So we call it DMO1, which is the imaging target that we have in the NHS to try and get diagnostics really early. And so that is total 32,000 specific imaging tests. And you can see on the right-hand side, the graph that goes up and then down, that is the backlog of activity in the NHS. And it correlates to the graph that's going up, which is the activity as we grow in the CDC. So you can see that the backlog is coming down because of what we've done in the Community Diagnostic Centre, which is really exciting. If I go to the next slide, one of the big reasons why we put the Community Diagnostic Centre in Wood Green was because we felt that it would have an impact on inequalities. We know that Haringey does not have a hospital. It does not have diagnostics easily accessible at all in Haringey. And so what we've been trying to do is actually demonstrate a little bit of what the impact is. Now, obviously, because you have to access your GP first, we can't get that front door, but we can show, and this is the graphs show, that 72% of the activity in Wood Green comes from the 30% most deprived postcodes in Haringey, compared to, as you can see on the graph, you can see how the dotted lines, the dotted bars, are the population of Haringey, and the dark blue is what we are serving. So you can see we are delivering against the population of Haringey on decile number 1. We're slightly lower on decile number 2, but we're really high on decile number 3. And that is a shift from when we first opened, because you can see that we were serving more people in decile number 5. So the richer end of the population, if you want to put it that way. So what we're showing here is that this particular service is really tackling or giving access to patients in who come from the most deprived areas of the population, which we feel is a really positive thing. If I move to the next slide, this just talks a little bit about some of the work we've been doing to try and make sure that our pathways are as good as they can possibly be, and that our engagement with the public and with the GPs is as good as it could possibly be. So we've done a lot of pathway work, but also GP engagement to understand why GPs may not want to refer to us, or why they might find it harder for their patients to come And we've been making that really possible now. And what's really, really great is that now 175 GP practices across North Central London, the priority on Haringey, have access to our digital systems so they can get the report straight away from the Community Diagnostic Centre, which is a real achievement of Mustafa and the team. We've also done a lot of patient engagement, and I'll come to that in a second, as well as trying to do this evaluation as I spoke about. So I go to the next slide. The next slide talks about some of that patient and community engagement. So we've done lots of site visits by service users giving us feedback. We've done semi-structured interviews with patients. We've done follow-up interviews and interviews with staff. We've also really targeted some 4 focus groups on the advice of people around here and others. So the Turkish and Kurdish community and the Polish community and the Black Caribbean community. And we've been doing workshops with those to understand how and why they might or might not access the Community Diagnostic Centre and how we can make that better. And we've come away with a whole load of things that we're in the middle of improving on. We have a longer term engagement plan in terms of, continue to get those insights from patients and from GPs. So I move to the next slide, which is the last one, and that is just to show some of the improvements we made as a result of that engagement. So we've optimized the booking slots so that it's better for patient choice and reduces some of the do not attends. We've made more appointments during the Freedom Pass travel hours. We've made earlier appointments possible and extended the hours into evenings and weekends. We are looking to translate more of our patient leaflets into more languages, particularly at the GPs. We've improved the signage and simple things like the telephone number actually now says Wood Green CDC rather than private number when it comes up. Things like that really make a difference. And we've introduced a pager system, so we realize that we're so popular that there is a long wait sometimes for blood tests, and so we've created a calling system for that. And I should just point out that blood tests and X-rays are normally, or we try and make them as often as possible, walk-ins. So you can be referred from your GP. So you need a referral, but you can walk in without an appointment. That has been problematic over the last few months. People may have heard feedback that they've not been able to get that all the time. And that is simply because of the demand and the access. And the exciting part, which is the phase 2, which is the reason why we've got less access at the moment than we would want to. And that is that in December, we will be opening up the basement. And the basement will have a CT and an MRI, which will be the first of its kind in a shopping city anywhere in the country, which we're really excited about. And but right at the moment, that has taken out some chairs for the blood tests, which has caused a few problems in terms of weights. But we're really excited about that. This next Friday, the MRI gets delivered, so it's all go and very exciting to see that happen. And we've got Mustafa on the line, and Mustafa is the general manager for the service, so he can also help with any questions.
Thank you, Jonathan. That's really useful. Dina in a second. I had a reason to mystery shop the CDC, and I was very impressed by how staff dealt with the booking, etc. So, and I hope that other residents have that experience too. I wondered if you had any reflections just on your 4,600, you're heading for 8,000, and how you might, and perhaps some of you may have actually already answered this in your presentation, how you'll make sure that that 8,000 is focusing on those areas where we know people are less likely to access health care in the way that we'd like them to, and need more support to do so, so that because there's less usage, good usage in some, and some of that might be about transport links and connections, but some of that might be other things too. So just wondering if you could reflect on that. But Zeno, you had a question.
Yeah, it's really about health inequalities. Really. I mean, that's been the biggest issue in health in this borough forever, really, because of the east-west divide and so on. And I just wondered whether you've got some, not for now, but whether you're developing some sort of evidence base of what this has done to try and tackle or change some of that profile, you know, some case studies, some interviews, some sort of, are you doing any evaluation of that? Because this is really, it's exciting when you know, the type of testing you're doing and identifying early. You mentioned waiting lists on, and I just wondered how you're evidencing this. I know you've got your bar charts, but you know, sometimes a few stories, some personal experiences, however it's done, and maybe some external evaluation to show that we might be making some type of inroad into that, the big ones, you know, like heart and blood pressure and, you know, all those sorts of things. That's my question. Sounds fantastic.
Shall I come back on?
Yes, please.
So in terms of reflections on going from 4,000 to 8,000, and will we deliver on the inequalities? And this partly answers Zena's question as well, and that is we have a GP dashboard which shows us which GPs are referring to us when and with which, you know, is it just X-rays they're referring, or are they also doing blood tests? So which modalities they are referring to us with, and that's the thing that we use to kind of keep that regular communication with the GPs to say, oh, hang on, you haven't referred for the last few weeks. Have you forgotten about us? Or have, you know, has something gone wrong with the IT system and we need to fix it for you? That sort of thing. And we're tracking that on a weekly basis. And we will continue to do that when we open the MRI and the CT. So we would hope to be able to keep coming back to you with the bar charts like that show it's continued. I will say that probably with the MRI and CT to begin with, we will be seeing more patients on a backlog who might be from all over the place while we try and reduce the backlog before we open it up to, you know, brand new patients. But so there will be a tick up over time. In terms of evidence base, yes, we've got independent people doing that. UCLP, you may know about, is the University College London Partners. They are an academic health science network, and they are running our evaluation at the moment. And they're the ones that have helped us with some of this data. It is interesting you talk about the softer side, and I think I need to go back and ask them, and maybe Mustafa, we can take this away to see whether we can get a report that includes that softer side, so the interviews, the, you know, and that side of things, because I think sometimes evaluations look too much at just the data. And just one final thing, I think the bit that we are really struggling with is the bit that is most important, and that is the outcomes. So what we really want to show is that because of this, you know, cancer has been diagnosed earlier in, you know, Black, Asian, minority ethnic people in Harringay. That's what we want. That we are probably years away from being able to get the data link through, unfortunately. So what we have to do is the stuff that we are doing, which is the input, as it were, rather than output. So have we made it more accessible and that side of things?
Can I just say, in terms of evaluation, I think academic, you know, when academic, you know, I've been involved in quite a lot of evaluations and research as being researchee. And I think one of the things is that stuff that's really, really interesting and is very humane and very, very powerful about people becomes totally tedious and anodyne because it is all done as anonymised research without any people in it. So I do think if you could get some of those softer side experiences and case studies, you know, I had my diagnosis, not if I went to hospital, you know, Mrs. So-and-so from Tottenham or whatever, I think that has quite a lot of weight and power. So I think you can get your academics to do that.
Thanks, Zena. I'm really conscious of time. I just wanted to just check in that you are where possible recording some of that. I was reflecting on leader feeling that perhaps carers aren't as aware of this service, and I guess that awareness will grow. But I was wondering about what data you're collecting about people who do come to visit, both in their ethnicity, but perhaps something like, do they have caring responsibility? Are they, you know, those kinds of things. So I don't expect you to answer that necessarily, but it'd be good to come back with just a little written response about that, just so that we know that those people are using the service. John, really quickly though, and then I'm going to have to move us on.
Just two points. One's quick, is my GP practice ain't aware of it. So if I could take data or information, pass it on, and I appreciate it. Second point, which you can become a leader of, is the oncology blood test system. At the moment, I'm having to travel miles all the way to Reading to get done, which is a 33-point blood test, which tells you in advance if any cell in your body has had new oncology problems or issues. As my colleague says, if you wish to become a leader in a field, right, it's the ideal way. If you've got a phlebotomy system now, the people with the underpinning knowledge, it is a blood test that can be done. It is a blood test that notifies people early enough, or if they have got a problem, it can be diagnosed. If you've got all the equipment now, they can actually screen it to find out where it is.
Thank you.
Chair.
Thanks, John.
Thank you.
Sharon, really quickly.
It's sort of similar to that, actually. Well, the first one, are we at capacity with this? Can it grow even more than it's developing at the moment? The second question is, what's its connectivity? For example, if people have to go to hospitals, beyond North Central London, or I could cite your case where someone's sent to Edgware, for example, which is a bloody difficult journey, pardon my language. It is, it's very difficult if you live on top to get there. Can they go and get their blood test in Wood Green as opposed to having to go back and on another occasion just for a blood test to a hospital in some far-flung area? Are we at the point where we've got that kind of connectivity, or will we be?
I might go to Mustafa for that question, because there is some connectivity, but it's not 100% if I understand rightly. But Mustafa, do you want to just answer that one?
Sure. I mean, we found with the CDC that the IT connectivity within the whole system has many flaws. But what we've tried to do is, with the work that we've done with all the GPs within North Central London, is to set them up to receive the results electronically, and we're almost complete with that work. We're at about 90% now across the whole of NCL, which is a massive achievement over the last sort of year or so. But outside of North Central London, I think it'll be very difficult to get results back to GP practices outside of that region, mainly because of the IT connectivity. But what we're trying to do initially is, as a system, is work towards a single system for all GPs and acute trusts within NCL to have access to the same systems. And then I'm hoping in the future that the vision is to expand this across the UK more widely. But it is going to be a longer term plan around the digital transformation, not just for the CDCs, but for the wider healthcare system.
Very hard for patients to understand that, actually.
I agree. I've got cases, people who don't understand why they couldn't also receive an email just with their result, and there's someone who's just been waiting for a letter from which for a while. It was really helpful, the GP practice, that they had it almost more than a week before I did. So it is difficult, I think, for people to understand, especially when our tech is we're so used to receiving something on our phone immediately. I had another thing which I'm not expected to respond to, but just to pick up on this, quite technical, just around how you're going to have the CT and MRI, and how that, and perhaps you can have a written response just on how that will work, where we're having referrals that you at the moment are going to a clinic, and you have a clinician who decides on whether or not you have the MRI, and then it bounces back, and how that will just work a little bit, and how it can work more smoothly. But because I think it probably does need to work more smoothly than it does at the moment, but especially from the patient experience point of view, but you're adding in another actor if you add in the CTC. So I'm just thinking about that, and it might be some of it might be about the technology. But I'm going to leave it there, because we've spent quite a lot of time on this one, but on these two items, but I do think they're really important. And I'm really grateful that you've come and that you've given us lots of detail. We've been following this work, and we feel it's really vitally important, and we do fully support it. I think you know that. And I know that you're coming very soon to talk to councillors to go through some of this, and I'm sure they'll have similar questions and other contributions as well about their community's experience. So thank you very much, Mustafa, and obviously Sophie's left us, and Jonathan. It's good to see you. Thanks. So I'm going to move us straight on to the next item, item 9, which is the Haringey Partnership, Borough Partnership update. Forgive me. And Sarah, is it you doing this one?
Rachel's going to start,
Yeah,
and then
Rachel.
I'm going to come in. Yeah.
Yeah, I'm going to start, and I probably won't share the slide if that's okay, just because I think people probably have got it as part of their papers. And this is a brief update for the board on where we are with the Borough Partnership. To introduce myself, I'm Rachel Lissauer. I'm the Director of Integration for Haringey. So I work for the ICB, but absolutely my job is around integration of the different organisations that serve residents and patients in Haringey. The Borough Partnership is really the structure by which we organise our joint and integrated working. And the first slide, our structure, shows where we've got to with the work that we've been doing over the past few months, which is to consolidate that structure and way of working in partnership, so that for our life course cohorts, we have got in place both a programme structure that's driving our improvement work and an operational partnership board that is making sure that we are routinely bringing frontline services together, and we're working at some of those interfaces, which are often the most difficult and challenging areas for families, for young and for old people. So that we've identified the priority areas for Start Well, for Live Well, for Age Well. We have got our neighbourhoods and health inequalities work that is very much up and running. So one of the changes that we've made is to have a bit more of a focus within the Borough Partnership structure on long-term conditions. We've got a very active long-term conditions steering group, which is already driving that improvement work and is now reporting in more visibly to our Live Well and Age Well partnership boards. We've also brought our screening, vaccination and immunisation work more visibly into the line of sight of the Borough Partnership. Again, we have a meeting and a structure which is led by Public Health, but where we have the primary care vaccine-IMS teams, the ICB vaccine-IMS teams, the school vaccine-IMS teams, all coming and reporting back on progress, and all of us thinking about how we essentially increase our uptake and how we particularly target those groups and communities where we have lowest uptake. Having got this structure consolidated, we've got a piece of work which is mapping out our engagement fora and networks, both across the council and the ICB, and as far as possible our partner organisations as well, so that we've got as a line of sight as to how our resident engagement can feed in and through to our Borough Partnership structures. So that's a piece of work that we have discussed with Jeffrey, we've discussed with Dan from Health Watch, and we're very much undertaking together. To give you a bit of a flavour of what we've been talking about, in August we took a report back from the Integrated Care Partnership. So that is for the whole of North Central London, the board at which councils and the ICB and provider organisations come together at a strategic level. Will is going to talk a bit more about that in the next item, so I won't dwell on it. But we also are now back up and running with taking highlight reports from each of our partnership boards. So that is happening every time we meet as an executive. I've included some of those highlight reports, but I'm not going to speak to them here. It's for your assurance that that we do have that that reporting mechanism. at the last meeting, we had a particular focus on speech, language and communication, and on the work that we're doing in Age Well. So just to mention, for speech, language and communication, we had a particular focus and oversight because partly we wanted to make sure that all partners are really aware that it's likely that we will have a SEND inspection during this term. It's not definite, but it's a possibility. And we've been doing some really encouraging work around the speech, language and communication pathway, using investment both from the safety valve, which is the council's big improvement programme, and also some ICB investment, so that we can do something that we've been trying to do for a long time in Haringey, which is to move from a predominantly specialist speech, language and communication offer to a more universal offer, where we have got speech, language and communication routinely being provided in early years settings and in primary school. So we have consolidated the funding to employ additional language support assistants for early years and for primary, and more specialist teacher and therapy capacity to do the kind of training on ongoing service delivery. That originated, we piloted it in Northumberland Park with a real focus on BAME groups, and that's continuing. Councillor Brabazon and I were at the SEND executive last week, and it was really encouraging to hear reports back from primary head teachers that they are noticing that is starting to be felt in the in schools in the front line, which is exactly what we want. So we had an update on speech, language and communication, and on dementia services in particular. And the next borough partnership exec that we've got is going to focus on children and adults' mental health and wellbeing, and is going to be at St Anne's, so that we are all on site and really focused on that. And that's, I know, an area of focus that has really come from this board as being has given direction and support for us, having that as our kind of golden thread that goes throughout the borough partnership work. So we are looking forward to that. And I think that is where I will stop. Sarah, did you want to add anything?
I was just going to add about mental health focus and that being the golden thread, so that you've quite neatly neatly finished. I suppose it's just worth saying that it takes a lot to get the, you know, all of the structures right within the borough partnership, and all of the partners engaged at the right level. And I think we've got there with it. I think we've got there with having structures in place that do allow for that more kind of strategic and transformation work to happen, alongside making sure that there is absolute oversight of the operational kind of interdependencies. And we're starting to build alongside that our outcomes frameworks and sort of monitoring approach. And that will be a focus over the next couple of months, and will likely take us into sort of the back end of this year. So yeah, that will be another area of focus for us over the coming weeks, alongside the engagement and participation bits that, yeah, we can really start to have a think about and think across those other structures that exist, to make sure that we're really maximising that impact and allowing sort of the right people to be at the table from a resident and engagement and participation perspective, and have influence alongside system leaders. It is also worth saying that part of this is very much around relationships and our ways of working and how we all work together. So That's also a sort of fundamental theme. And we have recently had start in the last week. I've got a meeting tomorrow with our workforce integration lead. So it's a post that is funded by Cassie and the GP Federation, and we've been waiting for someone to come in to really support the borough partnership with that workforce development plan. They are now in post, so it would be good at some point for us to bring a workforce focused discussion back to the Health and Wellbeing Board, maybe not the next one, the one after, but yeah, that's a really important post that we've now recruited to alongside the structures. Thank you.
Thank you, Sarah. It's useful to know where we are, and there is a lot of detail in that, in those reports, and of real value, I think. My question was going to be just around how we feel. One of the things that's come up, always came up in our progression towards the ICB and the ICS as a structure, was how we'd communicate with residents about what we were doing. And given the detail here, etc., I think it would be good to have a bit of a perspective on how well we think we're doing, and how well we're planning for the things which are co-production moments and where we can work with the community, but also there'll be moments where it's about information and how well we feel we're doing that at the moment. I'm just conscious that some of this is very detailed, quite complex, but that we should be making it real for residents and giving them confidence that we're working as a system well together.
Shall I respond to that? I mean, I think one of the things that's been difficult in the past is trying to work out how much we should communicate about the borough partnership and how much we should just make sure that engagement and communication are fundamental to the work we're doing within the borough partnership. I think we've landed on the latter. It's much more important that we're able to engage in a meaningful way with different resident and community groups as part of the work that we're doing. And much of that partnership work sits underneath the umbrella in one way or another of the borough partnership. And I do totally agree that we could and have ambitions. Can you hear me? Sorry, it's a bit crackly.
Yes,
yeah,
you can.
Yeah, we have ambitions to be doing more in terms of communicating out with residents. It's part of what we're trying to do. For example, things like making our mental health offer more visible to residents via websites and the way that we consistent information that is communicated. So we've got a lot of ambitions to do that. I don't think we necessarily need sort of separate branding to do it. I think that probably confuses people, but we do have an ambition to both do the on the ground engagement work with different residents, different community groups, and also to make improved communication part of the work, part of the improvement work that each of our different groups is kind of driving at.
Thank you. I just feel it's really important, especially as we go into, we're beginning to start some work on other technology, but making that connection between that work we're doing with what residents' vision is for being healthy, and making that strongly between how we're responding to that, the things we're already doing, and how that might change and evolve depending on what they tell us. But Gary, you've got your hand up.
Thank you, Chair. I was just going to come in at the end just to add to what colleagues have said. I think we've heard before about how we effectively communicate the offer, how that's shared, how that's understood, and the realization of what that looks like within the community. That's perpetual. I think that's a perpetual thing. It's just a constancy that we do need to keep doing. And we've got another event planned at the end of October. I know Rachel is aware. We discussed it at our most recent meeting a couple of weeks ago. But the point I wanted to make as well was, which we need to factor in, is also the accessibility and NHS 111 dial 2, which obviously the full rollout. And for those who aren't aware, there will be a geographical location here at St Anne's for that offer over the coming months. and the first part of that will kick in at the end of October. So in terms of the communication, what the offer looks like, that's very much a perpetual exercise, and we need to be using all the forums and everything that we have at our disposal to identify what that looks like. That's just something that continues to happen. But also it's about the full accessibility. And I did just want to shout out about 111 today, because as that develops further, I'm really hoping that that will have an impact to build on the talk before you walk and all the rest of it. And I'm hoping that that can have an impact in terms of prevention. And I can see Nana on the call there as well, maybe in some reductions in footfall to A&E. So there's lots happening. And just to build on what Rachel mentioned about the infrastructure, I agree. I think the strategic direction and vision now is better shored up by operational and clinical foundations in terms of the forums that have been established. And I think that's a good thing. Thanks.
Thanks, Gary. And it feels like that's the NHS number one, isn't it? We don't have a lot of time now to discuss that, but does that maybe that's something that we should bring back and have a conversation here as well? I think it's really important that you do also keep us counsellors in the loop. You know, I'm very happy to be invited to events. Hint. But and also think counsellors are a really good way of distributing the information and material on what's going on for residents, and counsellors really like to be really informed because residents come to talk to them all the time, so they can support that process. But I think I'm going to leave that item there because we've still got quite a bit to cover, and time is running ahead. But thank you very much, both. So we're moving on to the Integrated Care Partnership meeting update. Will.
Hi there, everyone. I'm Will Maris. I'm Director of Public Health. My computer's chosen the opportune time to go on standby. I'm going to talk really briefly because I think we've got winter update. In slide 29 of the pack, which is included for a partnership update, there's a few notes taking the Integrated Care Partnership. And this is a group which is very much, I think, in the forming stage. It's not as well formed and well developed as the group we have here in our Haringey Health and Wellbeing Board. But the Integrated Care Partnership is the key partnership body of the integrated care system for North Central London, and is where the leaders of all the councils in the 5 boroughs contribute to the agenda and priority setting and strategic direction setting for the integrated care system. So the last meeting of this group on the 11th of July, on slide 20, outline of the things that were discussed, which came to our last Health and Wellbeing Board, and the consensus on the Inequalities Fund is rather similar to the consensus we came to in our Health and Wellbeing Board. It's a really good thing in itself, but at the moment it is just separate from the core provision that our residents feel around NHS etc. So having the principle of the Inequalities Fund, like Jonathan actually talked about with the youth diagnostic centre, really serving those people who need health and care most, be widely applied and how we work in that way as an integrated care system. There's also an item on mental health, particularly on child and adolescent mental health services and crisis pathway for adult mental health. And it was noted that improvements have been made in CAMHS waiting lists. There's still lots of work to do, both on the services themselves for children and adults, but also looking at a wider model of how this. I think this brings us to one of the cruxes of how we're going to work together at North Central London level and at place level, because actually in actual those improvements where we know our communities have discussed that in our probably more particular leading discussion around how that works for children as well. In terms of next steps, we've brought a rather, shall we say, long population health strategy in Central London to this board before, And there's a recognition that that needs to be pared down. So there's some real clear priorities that would work on collectively population health in central London that will then be delivered both by London-wide action, but also at places. So there's a bit of a prioritisation process going on. I know that mental health, SEND, some of our public health work will feature quite strongly in those priorities will be for health and wellbeing. I included in the pack all the papers from the Integrated Care Partnership. It makes this pack very long and a lengthy reading, so I think we need to continue to do that so people have got a sight, but there's no expectation to read those papers in detail. But we will continue to keep those for reference. So I think that's all I wanted to say. I also wanted to use this opportunity to plug a session we've got on Monday, which is related to our place-based work and lots of work in my team speaking to local residents in our libraries, for example, speaking to children's centres to get their views on what makes better health for Haringey and the work that we're doing already. But we're going to have a big kind of set piece event Monday, which we're invited to. We've got a number of representatives that will help us in our health and wellbeing strategy into the ICP. So how we're going to deliver the priorities of the ICP. So
thanks. Thank you. Thank you, Will. I don't see any hands up. If you've done the silence. So maybe I'll move us straight on to winter planning, because I know that will be on a lot of people's minds and quite an area of concern.
I thought on winter planning, because there's going to be a bit of a, we're going to go through some of the work that's in place around. I'm just going to speak to some of the NHS work, and Sarah's going to speak to the sort of integrated work across the council as well. But I'm going to start on sort of public health prevention piece, talk about COVID vaccination, some of the wider winter planning. So as you're aware, we've had really challenging winters for the last few years with COVID, and last year we were kind of out of COVID, the worst of COVID, but we had a really challenging winter. We had scarlet fever, we had a really significant impact of flu. So can't emphasize the importance of some of these preventative interventions like COVID vaccine. I would say particularly flu vaccination as well. In terms of COVID vaccination, the programme has been brought forward and we're mobilising delivery locally in conjunction with the national programme to COVID vaccination, eligibility includes care home residents, all adults aged 65 and over, and then people in clinical risk groups and health and care workers. The programme started, the sort of booster vaccination started on 11th of September for those most at risk, and from now residents will be invited in priority order of risk. I actually tested out the COVID vaccination national booking system, and for those at risk, you can already book a COVID vaccination. And primarily, there's a number of pharmacies across Haringey which are offering the vaccination, which I think is really positive. And then more places will come on board in June. There is going to be now age find and treat particular populations, and hospital trusts are going to work to support care home and housebound residents. Just on terms of the COVID itself, there has been a rise in cases recently, rise in hospital admissions, but not intensive care admissions. And there's a new variant you may have heard about in the news, BA 2.86, but it's not currently classified as a variant of concern. And at the moment, the data is not causing significant concern. But of course, we don't know. We can't predict the future. Flu vaccination. So flu vaccination is delivered in a different way to COVID vaccination. A lot of pharmacies in the borough, again, after I'm testing, that are already offering it to people in at-risk groups, so over 65 and people with medical. And because of the delivery of flu vaccination, it's offered through all GP practices will reach out to their populations who are eligible over the next. There's also a school-based programme. for younger children aged 2 and 3 should be offered through their GP. Also wanted to talk very briefly just around how we're preparing for winter and cold weather. Cold weather as well as hot weather causes significant health impacts for people, and we have a group in Haringey that doesn't just talk about the COVID vaccinations, but also those kind of wider preparations that we need to make to keep people safe and give people advice in cold weather. Of course, had a lot of focus on the cost of living crisis last year in all spaces, and that hasn't gone away. I think people are struggling just as much as they were last winter, so we'll continue to provide advice and support. And one of the final thing I wanted to say on this is around kind of comms and engagement. So we will be sharing an update with board and with councillors, and we're also aware that we need to get all this information out to residents around what we're doing and how they can get these vaccinations. So we'll be working to do that through our ICB and council comms channels. So that's what I'm going to say on the vaccination programme. I know we've got other sections to talk about, so I'll leave it to you, Chair, about what these.
So I can see, I might take just a couple of questions on this one. Otherwise it might get very lengthy and confused, and John's been waving at me. And I think Sharon has.
Yeah, sorry. 2 points on the thing where you're saying it was in Haringey. I had my jab yesterday. Accessibility is non-existent on the booking system in Haringey. I'm highlighting to you as a professional, I make accessibility a priority, whereby instead of stigmatising those in wheelchairs having to travel 8.2 miles to get a jab, make it a better system whereby accessibility means you haven't got to travel an hour to get the jab. The other thing I was going to mention also is where you're trying to say the system is working and you're trying to roll it out, which is what I respect. But when you are rolling it out, we got a hub where 33 elderly people live. What I'm saying to you is bring the district nurse to the hub, right? Do it in one hit. It's easy and simple, right? And it makes the whole job easier for residents not having to put themselves out, right? Travelling 1 million miles just to get a jab. Might have side effects, might not have to travel, and might feel ill. That's all I'm trying to say to you, sir.
Thanks, John. And actually access to COVID vaccination did come up at the adult scrutiny on Monday, and there was some concern and concern that it isn't delivered in the same way that flu vaccination is. But I also understand well that it's not totally within our control how this is delivered and what we're giving it. And I think it's perhaps a national approach or a London-wide approach. Is that right?
I think we obviously want to work together and influence it, and we welcome feedback from our residents. There is sort of NHS central plan, and we have some control locally. And I think Cassie might want to come in around what the offer is this year. We're not as were in the pandemic. So, for example, your example of going out to a supported housing hub, for example, we may not be able to do that now because of resources. Whereas during the pandemic, we had to go out with focusing on appreciate that need.
Cassie, did you want to come in on that before I then bring Sharon and then?
Sure. So I think the first thing to say is at the current time, the amount of vaccine even available to community sites is quite limited. So I was part of a whole exchange this morning, noting that one of our sites didn't have enough vaccine for the people who'd been invited. There is very much a drive of a national approach. We have 2 GP practice sites, which are the 2 that we've always had, which are Bounds Green and Morris House at Lordship Lane. There are many more pharmacies now where people can access the vaccination. I think that is one of the things that has been really driven nationally, is to try and make that access available locally. I think there would be lots of practices that would love to be able to deliver it locally, but it's really complicated because we only have it come into 2 sites, and that would be a lot of work.
In terms of going out, thankfully our Whittington Health colleagues are taking it out to all of the housebound and all of those who are in care homes where there's frailty. As Will said, obviously it'd be wonderful to be able to take it out more far and wide, but it is simply not affordable. So the cost of the payment that we receive for every vaccine is less than it costs to do it now, pretty much. And so it is really challenging, and therefore outreach at this stage isn't possible. And frankly, we wouldn't have the workforce for it either, I don't think, at this point. So I think in the next couple of weeks, we will see greater accessibility. Not everyone is on the national booking system. So our two large sites, we are doing what we did from the beginning, which is sending out invites to everybody on GP lists in Haringey, to all of those who are over 65 and those who are at risk. So we're hoping, we haven't quite got through all the lists yet, because when we started, we only received about 1,200 vaccines. So obviously we've invited about 40,000 so far. So it is a challenge, but we're trying to get more, and we will get more in the coming weeks. So unfortunately, it'll take a bit of time, but we're getting there.
Thanks, Cassie, and we sympathise. And I might add that I myself was on a call with ICB colleagues and all my fellow health and wellbeing chairs, board chairs, and we did ask this question because we knew, so obviously government said it will be quicker, it will happen earlier and sooner. And we asked this question, well, are we ready, etc. And we were reassured that we were, but of course it is clearly difficult. You can't just ramp something up immediately. So I think there's quite continuously a bit of a gap between expectations and what is, I'll be blunt, sold to us nationally as this is all going to happen, and then how it's delivered. So and I say this because I can and others can't. So it's important to emphasise that. Nina, can I bring you in?
Indeed, actually, I'm actually quite pleased that we're having this conversation because this conversation is sort of predicated on people wanting the vaccine and keen to have access. And so within the limitations of access, as we've described, I think my concern is more about the people who don't want the vaccine. And it's now not just about COVID, it's also about flu and the rising sense of vaccine fatigue more than anything else, and in our particular boroughs. So I'm really keen to understand what our strategy is to try and combat that as far as possible. The second point I would make, if I may, is around, and I should know the answer to this, Will, but I don't. Just remind me, what's the approach for homeless people who are not necessarily on a registered list? And then the third point is just to remind folk, and I know you're all aware, but just from the heat and the heart of where we are right now, when winter lands and as it's landing, we do have the weather, we do have COVID and flu, but we also have industrial action that's also really, I mean, today with both consultants and junior doctors on strike. So there's quite a lot in our system in this particular winter.
Thanks, Nana. Those are really useful reminders, really useful questions. Will, do you want to come in on maybe briefly on some of the champions work? I think we do.
Yeah, the communications and engagement. So there's we use our standard channels that we have through the council to kind of just getting the NHS and getting the basics right and how they can get those out through different community groups. We do have programs where we're working with the voluntary community sector actively championing those communities. I think it's really difficult because so much work was done during COVID to reach those people who just weren't willing to have the vaccination. Then it's going to be very difficult to get those people vaccinated, but we'll keep on trying. And again, we do have less resource to do that engagement work than we did during the COVID pandemic. So it is challenging. On the Rust Feelers, ideally, we obviously want to get people registered with GP practices. Everyone should be able to register with a GP practice, and we're working hard to enable that. But there is some specific outreach work through, for example, Find and Treat, where people have access to vaccination in some kind of work through that as it goes on. I think the point that Cassie made around supply we want to time our communications campaign, make sure we've got adequate site. So that's why we haven't gone large, as it were, yet, because we haven't got a program in place yet.
Thanks, Will. And I think it's fair to say we've been a little caught up with all that in the past, where we used the national campaign and pushed hard, but haven't been ready locally on the delivery front, to be blunt, and it causes a lot of as counterproductive, actually causes a lot of disappointment, but causes confusion as well for residents. But I just think Will, maybe we need to bring to another meeting the work that you're doing in public health around health champions and working with those specific groups, or maybe we want to cite NENA and that separately outside of this meeting, because I feel we've had some really good conversations about how we target and support those, particularly communities. We identified and learned a lot through the pandemic, I think, NENA, around some of those groups, what the issues were. A lot of it was related to a broader inability to engage properly in health, and poor relationship and lack of trust, etc. So we have developed, your team has developed a program. We don't have time to discuss that now. I think it'd be good to maybe bring that to a meeting again, but perhaps anyone wants to be cited on that separately as well.
Yeah, we're not quite mobilised yet as well. So again, we can have conversations outside, and we do have conversations through the borough partner. So NENA will be cited, but equally our teams should be cited on those programmes involved in the development.
Thank you. Rachel, did you want to come in on winter planning? I'm sorry, I'm moving us on quickly just because of time.
Fine. I just wanted really briefly to mention what's happening in primary care around winter planning. So across North Central London, there is £2 million that's been made available for capacity in primary care. That has been designated to primary care networks in line with their weighted list size. So for Haringey, our primary care networks have somewhere between 35,000 and 55,000 each for additional capacity. There were a range of things that were tried last year, and PCNs have been invited to choose what they want to do from that range of interventions, and the majority of them are going to use their resource for additional clinical capacity. So just to say, there will be additional capacity in primary care, but I think it will be very much kind of bolstering their traditional capacity, if you like. The other main use of that funding is actually to maintain the GPs who are based at the front door of North Middlesex, seeing patients who come with primary care types of conditions. So that is allowing us, North Mid has been funding that over the summer, and the ICB will fund it for winter, which allows us to maintain it as a service with continuity. Cassie, you might so this is run by the GP Federation, and just very happy that will enable us to up that capacity. Cassie.
Thank you. I wasn't actually going to speak about North Mid, but I do think it's a great example of partnership, and it's been really good to be able to, some of the fruit, I guess, of working as a borough partnership is that we can all work more closely together. The other thing I was going to say was just we really welcome in primary care that the ICB has managed to bring out a really easy way of PCNs working on the Winter Access Fund. So they've done it earlier. Normally we're having these conversations in November because we've only just found out about the money at the last moment. The ICB often has, but they've created a much better system. And I think it's testament to the hard work that the ICB are doing, that they've been able to do that. So I just thought it was important to recognise because it makes a real difference to be talking about it in September, not November.
Thanks, Cassie. That's a good point indeed. Sarah, did you want to come in?
Yeah, Rachel, was there anything else from you, or are you happy for me to sort of give an update from a social care perspective? So linked to Cassie's point, because the money has been announced earlier this year, that has really helped with sort of the mobilisation of activities, and also the workforce required to deliver these. We know when we get the announcements from government late, that kind of makes the deliverability of the interventions much more challenging. So from a adult social care side, we've got sort of a number of sort of workforce initiatives and programs in place that's focusing on supporting hospital discharge. I'm super conscious that there's 1 minute left, so I'll just highlight one of those by way of example. So we do have a teams aligned specifically to hospital discharges with a service manager, team managers and social workers as part of that, and that's really about maximising the capacity of the team. So that's additional resource alongside our existing workforce, really focusing on the discharge process, the health only pathways, and making sure that we're really progressing the adult social care pathways in a timely way. So that facilitates assessments and reviews every 2 to 3 weeks, which is sort of quicker than where we've been before, and that seems to be working well at the moment. It is also worth saying there has been an announcement, I think it was late last week, of some more money, potentially some more government funding, but the devil is always in the detail with these announcements, and we are waiting to see what the detail is and how that money could be spent. But we will of course put it to good use when we know, and we can have our initiatives ready to go. And again, very much learning on previous experience over the last few years about what works and what doesn't, and making sure we implement those in a timely way. Thanks.
Thanks, Sarah. Just bring Beverly in. I think she had a comment to make around that funding. I think there might be some more information.
I just wanted to moderate expectations about the money. I think you're referring to the 40 million.
Yeah.
That's been identified just for certain ICS systems that are specifically challenged, and we are not one of those. We're in tier 3, tier 1 are being prioritised for the funding. Yeah, thanks. Just to let you know. I'm not aware there's any more money coming.
But it's a shame, and it's a shame that we've been mixed feelings about not being in tier 1. I'm really sorry, I can't take any more questions because we're just about to close the meeting. There's 2 things that I need to do. One is we've got a couple of AOBs. One is from me, and it's around the Better Care Fund. I will be seeing and addressing adaptations, modifications, etc. between now and the next meeting, and then I know that's going to come here, but that will be with me as the Chair of Health and Wellbeing Board. So it's just to reassure everyone that was happening. Rachel, you have an AOB?
It was that one, Councillor Dutton, just to say, is it? I hope that means you've got Chair's action to sign off 23-24, subject to our conversations with you, and then we will bring the 24-25 plans in detail in November. Does that sound in line with your expectation? I
think we've committed that I'll take a decision between now and then, but I think it'd be good to bring a bit of sketch of what we arrived at and where we're going. Perfect. To. Absolutely.
Thank you.
Gary, you have an AOB.
Thank you. Yeah, I just want to share some really good news, actually, really positive news for this forum, for the North London Mental Health Partnership and also for Harringay. After a process of just over 3 years, really, as soon as we moved into Blossom Court, the new build, we'd sent and worked on evidence-based approach about our practices and quality of care, clinical care, operational management, governance, and all the rest of it. And last week, when I was on leave, actually, we had word that the Royal College of Psychiatrists Combined Committee for Accreditation have fully accredited our 3 acute wards at Blossom Court. That's Daisy, Sunflower, and Tulip. I can tell you that's no mean feat. We're the only organisation in North London who have fully accredited wards for acute inpatient, and basically it means we've kind of got a centre of excellence, actually. So it's a brilliant news story for Harringay. I think it's a real landmark, actually. I think it's a bit of a dial changer, and I'm really hoping this will change some of the profile and some of what's reputationally been associated with St Anne's, I think, in the past. So it's brilliant news, and I wanted to share that today. So there we go. Thank you.
Thank you. Congratulations, Gary, to you and the team. It is a really important milestone, and I think we salute you for that. Thank you, and onwards to even bigger and better. And I know we're doing lots of work jointly, closely together, so I think we're due to meet about that soon. So looking forward to that as well, but really, really proud that that's the case. Thank you. Councillor Brabazon. Since we're sharing good news, we've launched our free school meals campaign. We launched it at the beginning of term. We have a video which is doing the rounds, and it was a film encouraging me. What we've done is link it to the pupil premium. So in Haringey, actually, our rollout of free school meals, as far as I've heard, has been really smooth. But the good news is that because we've changed the way we have contacted the families, the numbers, the percentage of people registering, the eligibility has gone up by over a few weeks by about 6% was my last piece of information. We are very low in the free school meals league table, Haringey. We're hovering around 25% of free school meals, which compared with Islington is around 40%. And some of that is, well, we have lots of speculation about why that is, but whatever the reason, one of the things we have done is change how we've communicated with the new parents, the 2,300 kids started in school this September, reception. And we're doing it centrally now rather than leaving it to the schools, to chase everybody. You may think, well, why didn't you do that in the first place? And that's what I think. But that's why we've changed it. And so far, so good. And we'll hear more tomorrow. So the more children get free school meals, the better their health will be. That's all.
Absolutely. Thank you very much, Sina. I think that really is an important, we're all really happy to hear that. So that's a really important part of our children and families being healthier, feeling better, more able to cope with the crisis we find ourselves in as well. So thank you. Thanks very much, everyone. We're only 6 minutes over. Take care of yourselves, and we'll see you in November. Thanks.
Thank you.
Yeah.
We didn't get to